I am joined with Dr. Casey Harbine for another edition of Morning Rounds. Thanks for joining us today.
Yeah, thank you.
Today we are talking about telemedicine. So what is telemedicine?
Right, so it's a growing type of supportive medical care delivery. It's typically providing more specialty care in areas where those specialists, medical providers are not available. They provide support for the other physicians there. It often involves a screen that interfaces with the patient almost like in a Skype style way.
Okay.
There's a nurse who's at the bedside with the patient, maybe performing some of the physical exam things while the specialist on the screen is viewing them and making the assessment. They're able to interact with each other, ask questions, those sort of things. They make treatment recommendations based upon that doctor-patient visit.
Okay, so is this something that we use here in our area?
Yeah, you know, actually St. Pat's has recently started using something that we call telestroke. While we do have neurologists in Missoula, we don't have a lot, and stroke is something that needs to be assessed very quickly, and if there's going to be treatment, that treatment needs to be delivered very quickly. And so this has been something that the emergency room's been able to utilize to kind of speed up that process so there isn't a delay. And so there's a neurologist that's on the other end, sitting somewhere in Oregon or Washington, while there are trained nurses in the emergency room kind of putting things on the patient and doing the neurologic exam, and they have a discussion with the emergency room physician and decide if they're going to deliver the medication for a stroke treatment. So there's also a program using our ICU doctors helping out in Polson at St. Joseph's Hospitals, providing some supportive critical care.
Interesting. All right. Well, then how do you feel about telemedicine then?
Well, you know, it's interesting. I went into medicine to interact with people,
right,
and so it almost feels like now I'm being replaced by a robot. I think medicine is getting very complicated. We want to have good care delivery to outlying places, you know, even smaller places than Missoula, and I think this is one way that we can help meet that supply. And really it's a supportive thing, and it's been pretty well received, but I think it's important for the public to be aware that this is going on, and so that you know, if they do show up in the emergency room and they're being cared for by a doctor on a TV screen, it's in a supportive, kind of collegial, cooperative situation.
All right. Well, so besides that, are there any other things important for the public to be aware about?
Well, I think it's always okay to ask questions, you know, to say, well, wait a minute, what's going on here, and how is this working, and how is this going to help me or hurt me? Those are always good questions. But I think overall it's been really well received, and we've really appreciated having it.
All right. Well, thanks for answering those questions for us this morning. If you have any questions you'd like us to answer, you can email them right to us, morningrounds@kpax.com.